with limited resources, limited personnel, limited supplies. Some people even forget that we're not in the back of an aircraft. When I got here, it was a very new program. I really wanted to create a foundation that would allow us to train, to be able to sustain our members, to prepare them for validation, also to prepare them for deployments.
I was a prior enlisted TAC B, so since coming over and becoming a nurse, I've actually started to integrate that tactical aspect to the medical side. We have blackout curtains to block out the light. Found a YouTube page that plays aircraft noise for hours. We then incorporate some type of low light, utilizing red light. If the aircraft's in low level light, then we need to operate in low level light.
Each training exercise, depending on the size and scope of it, I am looking at least 5 to 10 hours of prep work. So that's coordinating with members, preparing the fake blood bags, setting up the mannequins for the scenarios that we're going to be throwing at them. We had to create partnerships with the WRM, so War Reserve Material Unit, and also our warehouse, our logistics warehouse across the street, to be able to give us the real world supplies, to push real meds, to do the real hands-on tactile stuff.
And then we apply those expired supplies to the mannequin. Now, they're all labeled in here that anything in here is not for medical use. It's only for medical training. Trainees that come in here, they actually get to feel, touch, and actually properly utilize, for instance, a tourniquet. And here you'll actually apply a tourniquet, and if it breaks, whatever, we'll be able to actually watch you use it, make sure you use it properly.
We started first responder training about a little over a year ago.
We tailor our scenarios to focus more on them actually responding to a code, having to be able to find a patient and start their first assessment procedure.
We actually had an airman that had a cardiac arrest event out on the track by the hospital, and base fire was able to act very quickly and save that airman's life.
When we arrived on scene, we found one patient lying face down on the ground. One of our firefighters turned him over. There was no pulse present, so we began CPR. I had the opportunity to work with the mannequin quite a bit. I'm thankful that I had the opportunity to train with Major Strader, and with the realistic tools that he has, it helps us in pressure situations.
Our mission is to forge ready forces. So I think this initiative ties perfectly into what we're trying to accomplish as a warrior ethos and our culture here at the medical group, especially here at Nellis. This initiative definitely has gone a long way into strengthening our medics' readiness, but also their confidence. And a lot of it really has to come from that hands-on, in your face, a little bit more stressed situation and circumstances that are austere, circumstances that are not comfortable. That's where we have to expose them to that level of training as often as we can.